Understanding gluten, gluten-free diets, and celiac disease. Gluten is a protein found in wheat, barley, and rye. It acts as a binding agent, giving dough its elasticity and helping baked goods maintain their structure. While gluten is harmless for most people, it can cause serious health issues for individuals with celiac disease or gluten sensitivity. This narrative explores the role of gluten in food, the necessity of a gluten-free diet for certain individuals, and the implications of celiac disease. What is gluten? Gluten is composed of gliadin and glutenin, two primary proteins. These proteins help dough rise and provide a chewy texture in baked goods. Foods containing gluten include bread, pasta, cereals, and processed foods that use gluten as a stabilizer or thickener. Gluten is not inherently unhealthy. In fact, it can be beneficial in a balanced diet. Whole grains that contain gluten, such as whole wheat, provide fiber, vitamins, and minerals, contributing to digestive health, reducing the risk of heart disease, and supporting overall well-being. However, for certain individuals, consuming gluten can lead to severe health complications. Gluten-free diet, a trend or necessity. The gluten-free diet has gained popularity in recent years, with many people adopting it for perceived health benefits. While some believe eliminating gluten improves digestion, reduces bloating, and boosts energy, there is limited scientific evidence supporting these claims for individuals without gluten intolerance. Additionally, some gluten-free products are highly processed and lack essential nutrients. For people with medical conditions such as celiac disease or non-celiac gluten sensitivity, NCGS, a gluten-free diet is essential. They must avoid gluten-containing foods and carefully check labels for hidden sources of gluten. Many food manufacturers now offer gluten-free alternatives, including gluten-free breads, pastas, and baking flours made from rice, almond, coconut, or chickpea flour. Celiac disease, a serious autoimmune disorder. Celiac disease is an autoimmune disorder where ingesting gluten triggers an immune response that damages the small intestine. This condition affects about 1% of the global population. In people with celiac disease, consuming gluten triggers an immune response that damages the small intestine's lining, causing nutrient malabsorption and potential health complications. Symptoms of celiac disease. Symptoms can vary widely and may include digestive issues, diarrhea, constipation, bloating, and abdominal pain, fatigue, unexplained weight loss, anemia due to iron deficiency, joint pain and headaches, skin conditions such as dermatitis, herpetiformis, neurological symptoms, including depression and brain fog, delayed growth and puberty in children. Left untreated, celiac disease can lead to serious long-term complications, including osteoporosis, infertility, neurological disorders, and an increased risk of certain cancers. The only treatment for celiac disease is a strict lifelong gluten-free diet. Non-celiac, gluten sensitivity, NCGS, and wheat allergy. Some individuals experience symptoms similar to celiac disease when consuming gluten but do not test positive for celiac disease or a wheat allergy. This condition, known as non-celiac gluten sensitivity, is not fully understood but can cause gastrointestinal discomfort, fatigue, headaches, and cognitive difficulties. Unlike celiac disease, NCGS does not cause damage to the intestine, but avoiding gluten can still improve symptoms. Wheat allergy, on the other hand, is an allergic reaction to proteins found in wheat, including but not limited to gluten. Symptoms can range from mild rashes and digestive issues to severe anaphylactic reactions requiring emergency medical attention. The gluten-free diet. Challenges and considerations. Avoiding gluten requires careful meal planning and label reading. Even small amounts of gluten from cross-contamination can trigger symptoms in individuals with celiac disease. Some common gluten-free alternatives include rice, quinoa, and buckwheat, corn and corn-based products, potatoes, gluten-free oats processed separately from wheat, legumes and nuts, fruits and vegetables, dairy and unprocessed meats. What are the challenges of a gluten-free diet? The cost of gluten-free products is higher. There is also risk of nutritional deficiencies such as fiber, iron, and B vitamins. Limited food options in social settings can be another challenge. Cross-contamination risks in shared kitchens and restaurants may occur. To maintain a healthy and balanced gluten-free diet, individuals should focus on whole, naturally gluten-free foods, and be mindful of processed gluten-free products that may contain added sugars or unhealthy fats. Celiac disease diagnosis and management. Celiac disease is diagnosed through blood tests that check for specific antibodies, followed by a biopsy of the small intestine to confirm damage. Once diagnosed, individuals must adhere strictly to a gluten-free diet for life. Managing celiac disease requires not only avoiding gluten in food, but also being cautious about medications, supplements, and even personal care products, like lip balms that may contain gluten. Many countries now require labeling for gluten-containing ingredients, making it easier for individuals with celiac disease to make informed choices. The future of gluten research. Researchers continue to study gluten-related disorders to develop better tools to diagnose and potential treatments. Some emerging research focuses on enzyme therapies that may help break down gluten before it reaches the intestine, potentially allowing individuals with gluten intolerance to consume gluten safely. However, these treatments are still in the experimental stage. To wrap it up, gluten is a common protein in many foods, playing a crucial role in baking and food processing. While it is safe for most people, those with celiac disease, NCGS, or wheat allergies must strictly avoid it. A gluten-free diet is essential for these individuals, but may not be necessary for others. Understanding the science behind gluten-related disorders helps in making informed dietary choices, ensuring proper nutrition, and improving the quality of life for those affected. With ongoing research and increasing awareness, the gluten-free lifestyle is becoming more accessible and manageable for those who need it. If you found this video valuable, be sure to give it a thumbs up and subscribe for more insights. We love hearing from you, so drop a comment below and let us know your thoughts or any questions you have. Your feedback helps us improve and create content that truly benefits you.